Is ice bad for you? So this is a common question that is popping up due to some new research that has come out. So there is new research out stating that ice is not beneficial for acute injuries anymore. The research says that it is actually decreasing the inflammatory response, which is what we want when you have an injury. We want all those inflammatory cells to come in and heal the area. So ice decreases that response and causes some delay in the healing process. So a lot of my patients after a knee replacement, and then just people in our Facebook support group, are asking if icing is appropriate after a knee replacement. So if you aren't in the Facebook support group, highly recommend you join. There's thousands of people in the group. You'll realize really quickly that you are not alone. Please go to Facebook and search Succeed with Your New Knee and join the free Facebook support group. So this question is popping up often. People are wondering, should I continue to ice? I looked it up online and it's saying don't ice. My vote is yes, it is still beneficial, and there's a variety of reasons. So a knee replacement isn't like an acute injury. It's not like your basic ankle sprain, a knee sprain, anything like that. A knee replacement is a very traumatic surgery. They are cutting through tissues, they are removing bone, and they're replacing it with a prosthetic. So you're having a foreign object in your knee that is causing a huge inflammatory response. So we need to reduce those symptoms as much as possible to keep you functional during your day, being able to get up and walk and go to the bathroom, do your chores, make food for yourself, all of those things. You need to be able to do those things after surgery, eventually. I need you to keep those symptoms down so you can exercise appropriately and stretch appropriately. So first problem is the use of opioids. So you get opioids right after surgery most of the time, and you want to get off of those as quickly as possible. Ice can really help, that process of you getting off the opioids, which is great. We don't want to have our patients addicted to painkillers. Ice is great for that. The second thing that comes into play pretty quickly is the lack of sleep, and that causes a huge issue with your mental health, and just your ability to tolerate things throughout the day. Your overall patience dealing with this recovery and dealing with other people in your life, you need to sleep. I'm a new mom of twins, and I know that very well at this point. You need your sleep to be able to function. So ice can really help, throughout the night. You can ice, when you wake up in the middle of the night with pain, throw your ice machine on, set it for your 20-minute timer, and, automatically goes off. Hopefully that helps you go to sleep. If you don't have an ice machine, I recommend Polar Active Ice. You can purchase it on polarproducts.com. I have a coupon code for that too, Dr. Sam 10, to get 10% off. It's cheaper than Amazon. Another thing icing helps with, which is the most important part, is gaining your range of motion and your strength. So again, if you're going through this recovery, you know that swelling is hindering your range of motion. Your knee is very tight when you're swollen. Help that process by using ice. So I have my patients ice and elevate at the same time to help, move that swelling out of the knee as much as possible. You're not going to move all the swelling out of the knee with ice and elevation, but we just need to throw everything we have at that knee to help, meet your goals and meet your physical therapy goals as well. So ice is helping you, regain that range of motion, regain the bending and the straightening, and that can reduce your risk of having future procedures. So like the manipulation under anesthesia, things like that. So in my knee bending course, I utilize ice and elevation in the course throughout the whole 3-week course to help with, achieving full bend, full range of motion. So it's really effective. It really is. During the first 3 days of the program, I have the people in the course really hone in on ice and elevation, and most people see a significant reduction in their swelling and their pain. And then bending the knee is way, way easier. So if you're struggling with your bend and you want to join the knee bending course, again, it's on my website, succeedcourses.com. You can join. It's a lifetime access. You can join at any time. Once you purchase it, you can start right away. Also, in any of my courses, you have access to me. I'm like your coach throughout your course. And then lastly, strengthening the leg. So when you have swelling in your knee, it's difficult to strengthen your knee. So specifically the quad muscle, the muscle in the front of the knee, it's difficult to strengthen that muscle if you are swollen. If you Google the term AMI, you will learn very quickly that it's not your fault that your quad is weak. It is a neuromuscular connection that is happening. So there is a muscle inhibition. When you have swelling in the knee, there is a block between the brain and the muscle. They are just not communicating as they should be when there's any fluid in the knee. But that is another reason why ice can really help you after a knee replacement recovery. You can get that muscle strengthening back because you can use ice to reduce the swelling. I vote yes for ice after a knee replacement. Of course, ask your surgeon. It's very rare nowadays that I speak with a surgeon who doesn't like ice. They say don't over ice. You don't want to be icing 24/7, but every couple hours, every 2 to 4 hours, putting ice on for 20 minutes. Most of the time, surgeons are totally okay with that. As a physical therapist with my patients, that's what I recommend. We eventually wean off of the ice. That is the goal. You don't want to use ice forever and ever and get dependent on it. But ice can be very, very helpful after a knee replacement. Again, it's not the same as a simple ankle sprain. And if you're going through this recovery, you can definitely agree with that statement. So thanks for watching. I'll see you again on my next video.